Okay, let's talk about the mediastinum. We'll answer the questions, what is the mediastinum and what regional anatomy does the mediastinum contain? Hello everyone, my name is Dr. Morton and I am the noted anatomist. The mediastinum means midway in Latin. And so what does that mean, midway? Well, here's a cross section or an axial section through the chest, and there are the lungs that fill the lateral spaces of the thoracic cavity, and midway in between the lungs is this area known as the mediastinum. Basically, midway between the lungs, if we go side to side and front to back, it's midway between the sternum and the vertebrae. And then top to bottom, the mediastinum has the following regions. The superior mediastinum between the first rib and that transverse thoracic plane, and then the inferior mediastinum, which is between the transverse thoracic plane and the diaphragm. And the inferior mediastinum has three different sub-regions because we're anatomists. We have to name the daylights out of everything. So the anterior mediastinum is the region in front of the heart, and it's filled with the thymus. Then there's the middle mediastinum, which is filled with the pericardial sac, which contains the heart. And then the posterior mediastinum, which is everything behind the heart. And those are the structures, the dates, that we'll talk about in a minute. Well, what's the take-home message from this? Well, the take-home message is the following. Anterior mediastinum I'm not really going to cover because it's the thymus, and that's about it. And then the middle mediastinum we've covered in a previous lecture, so I'm not going to cover that. And so basically, the superior mediastinum and the posterior mediastinum are the two areas we're going to focus on. Let's first do the posterior mediastinum. So the posterior mediastinum is like the area behind our living room TV. So let's take a look at our living room, shall we? Yeah, I'm just kidding. That's not my living room. There's our TV. Okay, so there's our TV in our living room. If we were to look behind the TV, this is what it looks like. You see the wait, there's our TV right there. And then you see behind the TV things like the following. There's this red wire that goes all the way up somewhere in our ceiling, and I'm not sure where it goes. And then here's this green wire that goes all the way up, and that goes somewhere into the ceiling that goes into speakers for surround sound. And then there's this gray cable that comes from like a beta VCR and goes somewhere else. And so basically, behind our TV is a bunch of different wires shoved in behind the television. Well, the posterior mediastinum is like the area behind our living room TV, where our heart is our living room TV, and the posterior mediastinum is everything posterior to the heart, all those different wires. But unlike my living room, they're extremely organized. And so the posterior mediastinum, the stuff, the wires, the material behind the TV or behind the heart are the following: dates, which is an acronym for descending aorta, azygous system of veins, thoracic duct, esophagus, and our sympathetics. So let's start with our descending aorta. The descending aorta comes from the aortic arch, and at every segmental level, it gives rise to these posterior intercostal arteries. And I'm not drawing all of them, but at every level, and then the descending aorta goes and pierces the diaphragm through the aortic hiatus at the T12 vertebral level. And so if we now look at a lateral view in red, there's the descending aorta. We see the arch, that at every segmental level, we're going to see all of these posterior intercostal arteries that segmentally go and provide and enter the intercostal space. And then you'll notice that anastomosis with the anterior intercostal arteries laterally. Next is our azygous system of veins. And so here we have an anterior view, and let's ghost away through. So now there's our azygous system of veins, where there's the azygous vein, the accessory hemiazygous vein, and the hemiazygous vein. Let's talk about them in more detail, where you see all those posterior intercostal veins drain into this system. And so the azygous system of veins drains venous blood from the posterior wall of the abdominal and thoracic cavities. Let's take a look at the accessory hemiazygous vein. It drains those posterior intercostals from the upper left thoracic region. Then our hemiazygous vein drains posterior intercostals from the lower left thoracic and abdominal region. And then there's our azygous vein, which drains all the posterior intercostals from the right side of the abdominal and thoracic cavities. And then the azygous system of veins ultimately drains into the superior vena cava. So there's our azygous vein, and then goes into the back side of the superior vena cava where it drains into that SVC. Let's do this again from a lateral view, where there's our azygos vein as it courses all the way up, and then this azygos vein is going to collect all these posterior intercostal veins, and that are going to be seen segmentally entering into the azygos vein. And so what happens then is this azygos vein courses over that right primary bronchus, and that transverse thoracic plane dumps into this superior vena cava there. All right, now let's talk about the thoracic lymphatic duct and turn that green because it's the largest lymphatic vessel in the body. It arises from the cisternal chyli, and then it's going to course from the abdominal into the thoracic into the neck region. And the thoracic lymphatic duct transports about 4 liters of lymph per day. And so it's a closer view, and there's this thoracic lymphatic duct. It's very deep, right along those vertebral body. It courses up, and at this transverse thoracic plane courses over to the opposite side and ascends up and ultimately drains into the systemic circulation. Let's look at the esophagus now. So the esophagus is this structure here in brown, and it transports food from the pharynx all the way down into the stomach. But first it's got to pierce the diaphragm at the esophageal hiatus, which is located at the T10 vertebral level. And the vagus nerve, so the vagus nerve is going to innervate the esophagus. The left vagus nerve comes down after innervating the heart and the lungs. It then sends a branch to the front of the esophagus, and then once the esophagus hits the diaphragm, that vagus nerve courses along, right along the esophagus, and then enters into the abdominal cavity en route to the stomach. Whereas the right vagus nerve courses, and when it hits the esophagus, it more goes posterior, deep to the esophagus, and then both of these right and left vagus nerves are going to go to the celiac ganglia. Now, they do not synapse in these ganglia, but they course along with the sympathetics to the foregut and midgut. Now there's the esophagus, and so the right and left vagus nerves form an esophageal plexus of nerves all around the esophagus. Now let's talk about sympathetics, shall we? And so the sympathetics, such as the sympathetic trunk, all along the paravertebral region. And so think pearl for sympathetic ganglia and pearl necklace. So pearl is sympathetic ganglia, and the pearl necklace is a sympathetic chain. And the sympathetic ganglia are those cell bodies of postganglionic sympathetic neuronal cell bodies. And their information's destined for sweat glands in the skin, as well as structures in the head, neck, as well as the heart and lungs. And there we've got one sympathetic ganglia there, and there's another sympathetic ganglia there, and there's an internodal fiber that go in between. So there we've got sympathetic ganglia, the internodal fibers, but the whole thing's a sympathetic chain. What about the sympathetic innervation to abdominal pelvic organs, the splanchnics, greater, lesser, and least splanchnic nerves? Let's talk about those. So the greater splanchnic nerve comes from T5 to T9 sympathetic ganglia levels. And so let's look at this, where there's T5, T6, T7, T8, and T9 sympathetic ganglia. And so if we now find this splanchnic nerve from the T5 sympathetic ganglia, and then from the T6, and then from the T7, and then from the T8, and then the splanchnic nerve from the T9 sympathetic ganglion, they form a really big splanchnic nerve. So we call it the great, or the greater splanchnic nerve, that gives contributions from T5 to T9. It then courses through to synapse with a pre-aortic ganglion, specifically a celiac or superior mesenteric ganglia. Let's look at the lesser splanchnic nerve that comes off of T5 and T11, and then it courses down from both of these sympathetic ganglia, and it synapses with a pre-aortic ganglion as well. And then the least splanchnic nerve, it looks like it's coming from the diaphragm. I just don't have drawn. It's deep to that is the T12 sympathetic ganglion, and then it synapses with a pre-aortic ganglion as well, specifically aortical renal ganglion. There we got, that's posterior mediastinum. Let's go into superior mediastinum. And the superior mediastinum between the first rib and that transverse thoracic plane there are 3 different planes from front to back: venous, arterial, and visceral. Let's talk about each of them. Let's start with the venous plane first. And so we've got there is a right internal jugular vein that drains blood from the right side of the brain and head, and it joins with the right subclavian vein that's draining blood from the right upper limb. So they collectively come together to become a vein that drains the arm and the head. brachial for arm, cephalic for head. So the right brachiocephalic vein, which if you have a right, then there's also a left brachiocephalic vein. And both of these brachiocephalic veins come together to make the superior vena cava that then drains down into the right atrium of the heart. So there we have our venous plane. Whoops, pardon me. There we've got, I didn't mean to do that, there is our venous plane with all of the different veins labeled. Okay, now let's take a look at the finish of the story of the thoracic duct. Because when we look at this thoracic duct coming from the cisternal chyli, we keep talking about it being in the back of the posterior mediastinum, but what happens in the superior mediastinum is that this thoracic duct there drains in at that point. Drains into the junction of the left internal jugular vein, which is there, and the left subclavian vein, which is there. That's where that thoracic duct drains. And so to review of the lymphatic drainage, it's best to figure out before I talk about what the thoracic duct drains is what the right lymphatic duct drains. It drains lymph from the right side of the head and neck, as well as the right chest and arm region. And the thoracic duct drains everything else, drains lymph from the rest of the body. Okay, so now let's take a look at the arterial plane, and there is our aortic arch. And the aortic arch courses around at the very top of the aortic arch. It gives rise to three primary branches: the brachiocephalic artery or trunk that gives rise to a branch that goes to the arm, the right subclavian artery, and cephaly, the head, the right common carotid artery. That goes to the right side of the brain and the right side of the face. Then we have our left common carotid artery that courses up to the left side of the head and brain, and then our left subclavian artery that's going to give arterial supply to the left upper limb. There we've got our arterial limb with everything labeled there. Next is our visceral plane, where we see our trachea or the windpipe, and behind the trachea is the esophagus or our food pipe. And there we've got our visceral plane. And so, my friends, there is our mediastinum in a nutshell. The mediastinum, if we take a look at that transverse thoracic plane, above it is the superior mediastinum, which has a venous, arterial, and visceral plane. And then the posterior mediastinum, which the structures are the dates. And my friends, that's the mediastinum in a nutshell.